Good evening, everybody. I guess you can all hear me. I want to welcome each and every one of you here tonight. My name is Paul Kankey, and I am the Dean of the Central Campus at Central Piedmont Community College. And my job tonight is to keep all of us on track, the panelists on time, and to give you good folks an opportunity to ask questions if you have them. Before I have the individual panelists introduce themselves, let me share a couple of logistics with you. There are going to be, and you all have an agenda, I assume, there will be 4 presentations, and each presentation will be 15 minutes in length. The panelists don't know this yet, except for Carolina's Healthcare. Lois, you raise your hand. When you see a yellow card from Lois, that means you have 5 minutes left. And then I'll be the heavy at the end of 15 minutes if I need to be. So the yellow card is what you need to look out for. After the 4 presentations, there will be an opportunity for each of the panelists to respond to one another for 5 minutes each, and then there will be an opportunity for questions. You had an opportunity when you came in to place a card in a basket if you had a question. Or certainly, if you haven't had the opportunity to write a question down, you can do that and give that to one of the Carolina Health System folks that are here, and then we will take those questions. Now, the agenda was advertised from 6:30 to 8 o'clock. However, with the presentations that we've got here this evening, that will take us close to 8 o'clock. So we are going to go beyond that, if it's agreeable with you all, and hopefully wrap up about 8:30. So we'll still have the 30 minutes for questions and answers. Any questions before we get started? For those, yes. Yeah, there are seats up front for those of you that are not sitting and would like to sit. Also, the restrooms, in case you don't know, are out the door here to my left, up the ramp, and to the left. Okay? Starting with Carolina's healthcare panelists, please introduce yourselves.
My name is Dr. Tom Gettleman, sorry about that, and I am Vice President at CMC Randolph.
My name is Mary Beth Kuzmanovich, and I am a Vice President in the Facilities Management Group with Carolina's Healthcare System.
I'm not sure this is going to work, but I think you can hear me. I'm Lehman Bryce, the Town Manager for the Town of Davis.
Chris Bradley with Due Process Davidson.
John McClory, Due Process Davidson.
Jennifer Stiven, I'm a Davidson resident and family member of the someone suffering from mental illness.
I'm Dr. Jason Batley. I'm an orthopedic surgeon and chief of surgery at Iredell Memorial Hospital.
And I'm Ella Fields. I'm the executive director of the Mental Health Association of Central Carolina.
Great, thank you. Mary Beth and Dr. Gettleman are up first.
Thank you, everyone, for coming. What I'd like to talk about for a few minutes is an overview of the project. I'm going to talk about the facility design, and then Dr. Gettleman is going to talk to you about the facility operation. We've shared an overview of the project up to this point, and that has remained consistent. It's a 23-acre parcel that we have on Highway 73. We're projecting the total project cost to be about $36 million. And it'll be an inpatient and an outpatient facility. The inpatient facility is 66 beds. The outpatient facility is projected to be 10,000 square feet. And we anticipate that as the future growth of the need for services might occur, that we could work with the state and perhaps add some additional beds on the site and some additional square footage for the medical office building. As we've worked through the project planning, there are services that we will be bringing to the site. We have sewer, water, and roads. As you can see from the description, we'll be providing a sewer line that will also be available for access from other properties as they develop around the site. So that will be a public sewer. The water line will serve the site as well, and then the roads, right now we are just in preliminary discussions with the state of North Carolina on their requirements for Highway 73. And our requirement is that we will meet whatever they tell us. For those of you who have worked with the state before on roads, you understand that that's how the business works. Just to give you an orientation, this is Highway 73. This is the baseball field. This is Summers Walk. This is River Run Phase 5 to the back. So that gives you an orientation of where the property is at. This is a view of the design that we have developed for the project. As I said, it's a 66-bed facility, and as you can see, here's the proposed hospital building, and the inside has a courtyard. And that's so that our patients have the ability to go outside, enjoy, exercise, and have access to fresh air and activities in the outside, but that's an enclosed part of the facility. And then this building here is the medical office building. You can see where the road will come into the site and tie into Highway 73 with parking, detention, and then preserving as much as we can of the natural areas around the property as we develop it. One of the things that we wanted to share is a little bit, this is a very beautiful rural site, but with it comes some topography and some creeks and utility lines. So you can see that there are some topography differences. And this gives you a visual. Now, for those of you who are trying to be oriented, this is River Run Phase 5. This is Highway 73. This is where the facility would sit up here at the front. So it gives you a sense of what the view lines are from the back of the property line, and it gives you a sense of how it would sit in this design, and gives you a sense of how we preserve the nature around us and how it fits in with some of that beautiful but somewhat challenging topography. What we've done on the design of the exterior of the building is really to respect more of a lodge-like look, so that it is, perhaps some of you have seen a hospital setting, whether it's Carolina's Medical Center or Presbyterian's facilities, they look very hospital-like. This is being designed to be more lodge-like because we recognize the environment that we're in and the patient population that we're going to be serving. Again, you can see the courtyards inside. This is the front entrance where patients are admitted. This is where the medical office sits. So you can see the orientation as people come to the facility and the drop-off area. Another view to show you how the building would work. Our plans right now are to complete our design and work through the permitting process, starting construction fourth quarter of this year. And because we know that the need for patient services that we're bringing is very acute, we're on a very aggressive schedule, and our project team is working towards a year completion schedule so that we would be able to open in the fourth quarter of 2013. I'd like to let Dr. Gettleman then speak to the facility operations.
Good evening. As reflected on the screen to my side, Carolina's healthcare system is a mission-driven organization seeking to meet the healthcare needs of the citizens in our communities. The Davidson facility will provide inpatient psychiatric treatment for adults in a safe, nurturing, and therapeutic setting. Outpatient therapy and outpatient visits with a psychiatrist will also be offered. Many people are unfamiliar with the types of people who need specialized care provided in an inpatient psychiatric facility. I hope to paint a picture of what types of situations develop that lead people to need such care. At CMC Randolph, our adult inpatient units treat people for an average of 11 days. 52% of the patients are male, 48% are female, and typical diagnoses include major depression, bipolar disorder, and thought disorders. Here are two examples of the types of patients we treat on these units. Sam is a 22-year-old young man who came to the CMC Randolph Emergency Department for a medication checkup after missing his appointment with a psychiatrist earlier that day. He felt that his depression had worsened over the past 1 to 2 months. Sam was sleeping poorly for the past 3 weeks and having an increasingly difficult time taking care of himself. He struggled to get out of bed, bathe regularly, wear clean clothes, or finish basic household chores. He had little desire to be with friends and remained inside, alone most of the time. When Sam was 16 years old, he saw a therapist due to symptoms of depression. He also required inpatient psychiatric treatment 2 years ago due to depression with suicidal thoughts. Sam has a family history of mental illness and substance abuse. Both his uncle and maternal grandfather abused alcohol, and his father struggles with depression and attempted suicide a year ago. Sam lives with his family and has the support of his family and his friends. He does not abuse alcohol or use other drugs, and he has never been arrested. He graduated from high school and completed 2 years of community college. Sam received a comprehensive evaluation while in the emergency department. He also received new prescriptions, and he was due to see his psychologist at CMC Randolph the following day. Sam came to his appointment with the psychologist and told him about how his depression and anxiety were getting worse, that his motivation was poor, and that he had trouble concentrating. Though he denied thoughts of hurting himself, he acknowledged that it was getting harder and harder to live. Over the next 12 days, Sam's depression worsened, and he began to have thoughts of hurting himself. His family took him to CMC Randolph Emergency Department, again where he was evaluated and assessed as now needing inpatient treatment to maintain his safety. During the visit to the ED, Sam stated that his depression had worsened since he came back from a trip to Colorado 3 months earlier to visit his girlfriend. They broke up during that visit. After returning home, he stayed in his room most of the time. He cried frequently, he had no interest, and got no enjoyment out of doing what he previously enjoyed. He had little energy, he slept too much during the day, and too little at night. He had constant negative thoughts about himself. He told the emergency room doctor that over the past week, he thought about suicide every day, and he had made plans to commit suicide by carbon monoxide poisoning or via hanging. During his short inpatient stay, Sam received comprehensive treatment from a multidisciplinary team comprised of a psychiatrist, nurses, a social worker, technicians, recreation therapists, and a pastoral care professional. He made significant improvement. His depression lifted significantly. He no longer had thoughts of harming himself. His sleeping energy level and concentration improved, and he became more goal-oriented. Sam was discharged home and continued to receive treatment in the partial hospitalization program for the next 12 days. He then returned to his outpatient psychologist, where he continues to do well. He is currently employed and remains living with his family. Kathy is 26. She is a female who was treated at CMC Randolph in 2010 for 10 days. One night during the spring of 2010, Kathy's mother awoke to find that all of the lights were on in their home. She discovered Kathy in the bathroom and could not arouse her. In a panic, she called 911. Kathy was taken to CMC University for emergency medical treatment. She had taken an overdose of pills combined with alcohol. She was medically stabilized at CMC University in their intensive care unit and subsequently transferred to CMC Randolph to begin treatment of her acute psychiatric illness. Kathy has bipolar disorders with psychotic features. She struggled with mood disorder early in the spring of 2010. Her mother noticed that after she had returned from a visit with some family and friends in her college town, she came home and seemed confused, a little disoriented. She told her mother she didn't feel she was herself. She had what appeared to be a seizure and was taken to a physician to evaluate her, but it was determined that the seizure-like symptoms were more reflective of the psychiatric illness that she was struggling with. She continued to hold down a job, but 1 week later lost her job, and that precipitated an increasing intensity of negative and racing thoughts, a downward spiraling of depression, and the development of auditory and visual hallucinations. In an attempt to quell the voices and stop the negative thinking, Kathy overdosed. Kathy was admitted to the inpatient unit at CMC Randolph and, as I mentioned, stayed there for 12 days. During the hospitalization, she did very well. The therapeutic environment of the hospital, combined with her medications and the psychosocial interventions provided by her treatment team, helped lift her depression, end the hallucinations, greatly increase her range of emotion, and energy and removed thoughts of harm. She was discharged back home with her mother and grandmother to continue in outpatient treatment. Kathy was very involved and consistent with outpatient treatment. Since her discharge from Randolph in late spring 2010, she continues to do very well. She recently started a new job and has a supportive group of friends and family. Sam and Kathy represent the types of patients treated in an inpatient psychiatric facility. They required specialized treatment in a safe, nurturing, and therapeutic environment that is simply not available in non-psychiatric settings or in an emergency room. The new Davidson Hospital will offer people like Sam and Kathy with the care that they need. Thank you.
We'll now hear from the town of Davidson.
Thank you. I need a little help back there. I need my presentation, please. Sorry. Great. Thank you, sir. As we have talked about the CHS facility around Town Hall, and listening to citizens, we've identified 4 main issues that seem to be revolving around it. Those are planning, the fiscal impact, the public safety impact, and the diminution of property values. So I want to talk about those 4 issues tonight. The first one has to do with planning. I can tell you that about 3 years ago, using a lot of citizen input, the town created a comprehensive plan, and that plan called for the Davidson East property, the site for the CHS facility, to be rezoned to create an employment campus. So after that recommendation, the town board and the planning staff embarked on creating a flex campus planning area, which was applied to the area in September of 2011. The employment campus, or the flex campus, was created in a way that the town staff could approve most of the development on the site, and there were even opportunities for the development or some of the buildings to be approved without design review board approval. The design that you see of the CHS facility is actually one of those. It will require site approval by the town staff and not DRB approval, or design review board. We spent about 9 months creating that zoning with lots of public meetings, a lot of work with Community One Bank, the current owner of the property, to create that zoning. So there was a lot of input into creating that. Second aspect is the town board goals. You can read those 2 goals. They're 2 of the 5 primary goals the town's working on for the last 2 years. And they all have to do with economic vitality and fiscal stewardship. And so in order to promote more economic development and be more business-like, the town, in addition to creating the Flex Campus, also has reviewed their other planning ordinances and decided in some cases where there are good planning area plans that the staff would also approve developments in those, and they would not require planning board or town board approval, all in an effort to become more business-friendly. Those of you who are familiar with zoning ordinances, you've probably looked at them, and they have these zoning areas, and under that area they have this long list of things that are permitted in those developments. Davidson has not used a zoning ordinance of that nature since 1995 when we adopted our land plan. We use a form-based code that is about design of the public spaces and design of the buildings, and there's less concern with what the uses are in the buildings. So design is critical to us. The next item is the Flex Campus. There's been some concern about, well, there's one other item before that. There's some concern that the entire Davidson East property could develop as a non-tax-paying entity. That's possible but not likely, but the town board has authorized the planning staff to do a complete review of the planning ordinance over the coming year, and that's one of the issues we will look at to make sure that that is not something that would happen to us. We are serious about becoming business friendly. The Flex Campus that was created, one of the uses that's allowed in the Flex Campus is commercial. And the text you see below the word commercial is the definition of commercial from the planning ordinance. And you'll see in that definition, healthcare services. The CHS facility is certainly a healthcare facility or healthcare service, and so we believe that that use is permissible in the Flex Campus zoning. We also have heard about the physical impact. To kind of address that, we are an expertise in financial analysis. We hired a development, I'll give you the name of it, Development Planning and Financial Group, Lucy Gallo from Chapel Hill, to take a look at the information that was provided by CHS about the finances of the facility. This is just the impact of the construction that you see here, and I need to define for you direct effect, indirect, and induced effect. The direct effect is the direct effect of the spending on building the facility itself. The indirect effect is the effect of purchasing things and working with vendors in the area. And the induced effect is the spending of those indirect dollars in the area. So it generates a $58 million boost in the economy, just the construction of the hospital, and creates temporarily 411 jobs. I just got this afternoon, so I'm not as familiar with it as I'd like. But the permanent impact, we know there are going to be 155 jobs at an average salary of $55,000, which generates a payroll of $11 million in the area. Granted, all of this will not be in the town of Davidson. All the people will not live here, but we can't sort through that in these analyses, I'm told. The induced effect of that is another 56 jobs created in the area. The future impact, it was very difficult to predict the future impact. From our research, we could not find a standalone behavioral health facility that was built since 1986. What we were looking for was one that had been built, and to see what kind of development occurred around it, we couldn't find that. Most of the facilities are built as a part of a general hospital. So we were very conservative in our estimates that there could be an additional 10,000 square feet of commercial support retail, if you will, around the facility that would result in $1.5 million in value and a $5,000 property tax bill on an annual basis. Also, we would suggest that of the 155 jobs, there would be 238 additional residents in the area, and they would have a need for new homes. They would have additional spending in the region, and those new homes and that spending would generate $143,000 in annual revenue from sales taxes, occupancy taxes, etc. So those are, and when you combine the 143 with the 5,000 from the future development, that's an income of $148,000 to support that new development. The other concern is the impact on public safety. You have to know ahead of time that currently Davidson Police Department provides police services in the ETJ, which is where this site is, already. We have an agreement with CMPD. We provide the first response service to the ETJ, and they provide our communications 911 services in exchange for that, so we're already providing service there. The Davidson Fire Department also provides fire and EMS service in the area, and that's done through an agreement with Mecklenburg County and Mecklenburg County Medic. We would anticipate annexing this site by petition. We ordinarily require annexation as a part of allowing water and sewer extensions to developments. A direct impact on the police department. We took a look at the Randolph Road facility. We as I said, couldn't find a better example. And we have estimated that would, if this facility were like the Randolph Road facility, and it will not be, It's a new facility. It's in a different kind of environment than the Randolph Road facility. But if it were, we would anticipate a total of 3 calls per week generated by that facility. And we don't anticipate that that would require any additional police personnel, facilities, or equipment. On the fire and EMS side, that's a little more difficult to find. We did learn from Charlotte Fire that there were 9 fire calls last year. There were a lot of EMS calls. We could not validate all of those. There were about 3 or 4 different facilities at the Billingsley Road facility, so it's hard to tell whether they were going to the behavioral health hospital, to the emergency room part of that, or to the detox center, or whatever the case may be. Medic estimated that 85 to 90% of their medic calls, EMS calls, were related to the emergency room only at the Randolph Road facility. So we took 85% of the total number of calls, which is 70. And you see here that would generate for the fire department 1.5 calls per week. We again don't think that that would generate a need for additional personnel, facilities, or equipment, and would not affect the ISO rating for the town at a 5 or the ETJ at a 9 point or a 9E. The next thing you're going to see is a vicinity map, and this is similar to the one you saw on Mary Beth's presentation. You can see the site outlined in red, and what we're trying to do is look at an area within a half mile of where we predict the facility to be on the site, and that's the green dot. There are 5 single-family homes within about 700 feet of the facility. The building itself, from the measurements you see here are from the building where we predict it would be to the property line of those single-family homes. The closest being 410 feet and the farthest being 709. There are 3 or 4 communities that are near the site or near the facility. The edge of River Run Phase 5 would be 2.29 miles to be in the closest, and Davidson Run would be 0.62 miles, being the farthest. Within this, the red line is a half-mile radius around the proposed facility. And I point those things out because we went to the Randolph Road facility to look at values, property values in that area. We looked at property values within a half mile of the Randolph Road facility. The overall values were $5,005. Reeval increased them by 16%. Single-family homes increased by 17% due to reval. Other residential, being multifamily, actually decreased 0.43%. And if you compare those kinds of increases to Davidson, our overall value due to reval increased 21%, and the Mecklenburg County overall value was 15.8%. So I would suggest to you that the increases that you're seeing in the residential area around the Randolph Road facility is very similar to the value increase across Mecklenburg County. So our conclusions would be that the CHS facility complies with our comprehensive plan, the town board goals, and the planning ordinance, that it provides significant economic impact for the area, that it creates no significant impact to public safety services, and that there's no projected diminution of property values. Thank you.
Next is Due Process Davidson.
Thanks for putting this together, Mary Beth and Tom. I want to thank you both personally for your professionalism, your courtesy, and your transparency during this whole process. You've provided everything we've asked for, every question we've asked, and you've answered in a very professional manner. I want to thank you for that. Did you pull hers out? All right. I'm going to stand back here so that hopefully the remote will work and I can see the screen. Our purpose tonight, and has been since we started this whole process, is to promote thought, dialogue, and debate so that the best interests of the town are considered for this and for future projects. There is no debate. Mecklenburg County needs another mental health facility of this type. We're not here to attack the facility in its, what it's going to provide in any way. And be assured that CHS has other by right parcels that they have identified that could possibly meet this need. So this is not the only piece of real estate available for this project. So if it goes away, it doesn't mean the need is not going to be met. This is not, from our perspective, this is not an NIMBY issue. This is about leadership, decision-making, and due process. And this is about citizens having a voice in that process. We're going to talk real quick tonight. It's hard to condense everything into 15 minutes, but zoning, we feel, is inconsistent at best. Economic development is less than promised, and the process has not been transparent. To put this into the context we all need to think about, and how, when this decision is made to go out and recruit and to ask a facility of this type to come to our town, we need to understand fully what kind of an economic and fiscal crisis we're in. You can see there, those are the numbers directly from the town's document, and we've spent over $6 million in the last 4 years to subsidize a failing business. We're not in a position to give away tax revenue. The results have been reduced or eliminated services and events in the town. Public Works has a 33% decrease in their budget. Economic development, a 54% decrease. We lease fire coverage from Cabarrus. We have growing debt with no debt service in the budget. Night services that we used to have, like leaf removal, don't exist, and our signature town event, the 4th of July, has been reduced to July 1st on the green celebration. The other end of that is we pay the highest taxes in the area. Okay, 41% higher taxes than the Cornelius. Do Davidson residents receive that much more in service and benefits? I don't think so at this point. Zoning, as Lehman said, the old area, Davidson East, what we're referring to, were previously mixed use. And while the indicated Community 1 participated in the rezoning, at the end of the rezoning, Community 1 filed suit against the town over the rezoning. So this is another issue that the town has to deal with based on decisions that were made and that ended up costing us money. The planning board mandate was to create taxable and employment creating entities. As Lehman said, they came up with the flex campus area. Okay, this is the addendum that will go into the ordinance that was created from these meetings. And it's interesting that the description, the very first part of this new flex campus, development in this district shall encourage pedestrian activity through construction of mixed-use buildings and connections to neighborhoods and employment centers. I don't think that a facility that holds involuntarily committed patients meets that very first requirement that's up there, right out of the town document. Additionally, you'll see he talked about limiting the tax-free issue on the property tax, and there is, so one type of tax-free entity is limited to 5 acres, but this non-tax-paying entity is not. So some inconsistency there. Why is that in there? To protect the tax base. These are the by right items listed specifically. Commercial, yes, and we're highlighting that for a reason. But you notice hospital is not specifically listed in that document. If we look to another part of the ordinance, we show some inconsistencies. This is the college zoning area. Commercial and hospital are completely separated. Why completely separate them in one part of the ordinance, but then when you say you're interpreting this particular project, they're the same thing? Again, some examples of inconsistencies. Nearby towns, everybody in the area classifies the hospital as institutional. And nearly every area, they also have a conditional permit in the language. In other words, you can apply and we'll review the application before we say, yes, that actually is by right. Okay, Cornelius is the same thing. Interesting, in Cornelius, where it is listed as by right, it is listed as a hospital. All the other towns in our vicinity classify hospitals as an institution and protect themselves by allowing for conditional permits. Why doesn't Davidson do the same thing? Do we really want everything that can be lumped into commercial in this very important area? Do we really want to open the floodgates for large nonprofit businesses to take up revenue-generating parcels? Remember, Huntersville turned down this after much discussion. We haven't had the proper amount of discussion, and we need to look into how we can have further discussion before this goes any further. At this point, I'm going to turn this over to John McCrory, and he's going to talk about the economic impact.
Given the brief amount of time we have, there's a great document for those of you that want to see it, published by Mecklenburg County that speaks to the expenses by town, and it's well worth the reading. We have a few copies for those of you that are interested. As Chris said, this is in no way a pushback on the facility or CHS's plan. This is really us trying to take our town back. This is the first time we've had an opportunity to really engage the town in the discussion, and I think it's important for those who haven't had a chance to dig into the financial facts, please do so. The information that Lehman shared tonight, we've been asking for 6 weeks. This is the first time we've had a chance to see it. What the town folks would like you to believe, 411 construction jobs, nearly $25 million. We don't have a construction company in the Davidson area to do this project, nor do we have a worker base that can support it. 155 incremental CHS jobs, nearly $13 million. We'll talk a little bit about the logistics and the realities of those people coming from Davidson. Additionally, 238 new residents and the taxes associated with that, and the challenges of having new retail or service business revenue as part of this project. I spoke a second ago about the construction jobs. It's realistic to expect that next to none or virtually all of these jobs will be done by workers coming from outside of Davidson. 97 of the 155 jobs are below $53,000 a year in annual compensation. The Davidson household income average is $80,000. These aren't people that are likely to live in our community. We pay the highest property taxes in the area, so those who could afford it and would want to be here are not likely to come here. They're likely to go to Cabarrus County. They're likely to go to Huntersville. There's 6 Cabarrus neighborhoods that are within 6 miles of the facility that have new home inventory. Where do you think they're likely to go? Further on this, the likelihood of retail and service business revenue coming to our town and entering our tax base is highly unlikely. The logistics of getting to the site push you through Kannapolis or push you through Huntersville. It does not bring you through Davidson. Most of us that live in the area spend more money in Huntersville not because we want to, because we have to. 4.3 miles from the site to exit 25 and Park. And those of you that don't know, one of the additional developments that's coming from Huntersville is a town-sponsored retail and mixed-use project that will be directly across the street from this, and again, supporting Huntersville's tax base. What's real about this? Given the fact that the CHS project is nonprofit, into a 10-year time frame, we'll give up $1.2 million in property tax values, and we'll have associated spending that we don't know about because the town hasn't done the planning and the diligence to figure it out. But we'll clearly have more burden in utilities and services, and that'll put more pressure on the tax base. Meanwhile, Huntersville and Kannapolis will benefit our expense for the retail services and housing as previously discussed. Folks, this is a project that provides regional benefit. We all agree. I have a sister I've shared in other meetings that has struggled with mental challenges for most of my adult life. And I've been to Duke University and other places getting treatment with her as a family. It is absolutely something we need. Why haven't we partnered with surrounding towns like we've done in other areas? Specifically, the Commerce Station one where we partnered with Huntersville to the tune of $1.2 million, and we've returned zero from it today. And again, the result of bad decision-making, folks, is this. The highest cost of living in the area. We pay 41% more in taxes than communities. What do we get out of it? Hand it back to Chris, talk a little bit about the process.
Okay, thank you, John. Shortly after Huntersville rejected the CHS project, the town reached out to CHS and asked them to look at Davidson. Who from town leadership was involved? We've asked questions. It's not very clear, but it doesn't appear that it was widespread. Once the project began to move forward, property owners were contacted and asked to keep quiet until the news conference happened about the proposal. It appears no planning board, CHS, and community bank requested the formal zoning interpretation from the town for parcels located in the flex planning area. It's very important to note that this property is very desirable to CHS for geographic reasons. Where it sits is central to several of their locations and is a very advantageous location for them. Here was a great opportunity to negotiate for something in lieu of taxes, an opportunity that was not taken. The town responded with a by right approval letter dated May 7th, 2012. On May 9th, 2012, the town holds a joint news conference announcing the facility along 73. No formal cost or impact numbers are presented by the town at this time. This is a copy of the letter, the approval letter that was sent. And you'll notice that this, according to the ordinance listed, started the 30-day clock where any aggrieved party would have the opportunity to appeal to the Board of Adjustment on this zoning issue. At the town meeting on May 15, 2012, we were told there was nothing to stop. Again, the letter was dated May 7th. At the Commissioners' chat on May 29, 2012, we were told there's nothing to stop. Again, the letter was dated May 7th. Yet when our attorney discussed starting an appeal to the Board of Adjustment, he was told the clock had expired. So quite frankly, something was going on and it wasn't communicated properly. We can only verify that 3 of these letters were received by potential property owners. By the town's own map that they just showed you showing proximity, I would argue that there was a lot of property owners that could be potentially aggrieved by this. And our big question is why weren't more received? Nobody in the June Washington area received a copy of this letter. We cannot find any public posting of this letter anywhere. Okay, so the letter was dated May 7th. Okay, and look at the postmark on one of the letters that was sent out, May 17th. So you started the 30-day clock, and you waited 10 days to send out this letter to a potential aggrieved party. I don't think that's due process. I don't think that's fair, and I don't think that's the way Davidson should do business. It's reasonable to suggest that anyone in the June Washington area should have received the letter. Here are 7 property owners in the June Washington area that did not receive a letter and want to be a part of this process. They deserve a right they have a right to be a part of this process. Why were we twice told there was nothing to stop? Why did the town attorney fail to mention the letter to our attorney until the 30 days had passed? Why did the town completely ignore the option of conditional approval? All right, what's the right thing to do at this point? The right thing is to give those residents listed formal notice of the zoning interpretation and start their 30-day clock to appeal to the Board of Adjustment. At this point, we haven't taken the next step in legal action, and hopefully we won't have to do that if the town of Davidson will please do the right thing in this matter. Thank you.
Next, we'll hear from the behavioral health advocates.
Again, I'm Jason Batley, and I appreciate the opportunity to be here tonight and to address this issue. It's an important one. There have been a lot of concerns regarding this facility. Many of them have been addressed over the past few weeks, and there's been a legitimate debate regarding the process, which should be discussed, and I believe that debate will continue. My goal tonight is to actually shed some direct light not only on the need for this facility with some real examples, but also on the reasons I think Davidson is an ideal location for this, and on why I believe the debate regarding the process, although important, it has been a little misdirected. A few facts to get this started. Some facts we're all too familiar with here, some of which you've heard. Among 15 to 24-year-olds, suicide is the 3rd leading cause of death in this country. In 2007 data, 12% of high school students had contemplated suicide. And in a school of 2,000, that's over 200 students. In a school of 2,000 in 2007, 50 students would attempt suicide. So this is not an isolated issue. In addition, many people in this room I know, including myself, have accessed mental health services. These are people who are suffering extraordinary challenges in their lives. There are people with post-traumatic disorder, any number of factors. And the frightening thing about that is there are genuinely at times when it's not difficult to access these services, but it's outright impossible to do so, both from an inpatient and outpatient standpoint. One example of that is at one of the hospitals where I work. I'm on the administrative board. We had a patient come to our emergency room on his own requesting help. He was suffering some challenges. He was feeling as though he'd harmed himself. He was admitted to our emergency room. He was evaluated. And what people don't understand is most hospitals in this region aren't equipped to deal with inpatient psychiatric care. You can't just admit a patient to a hospital room and say a psychiatrist will see you. You have to keep that patient safe in the emergency room until which time you could find a suitable place for them to go. We boarded this patient in our emergency room and provided care for them for 3 weeks until a bed was found outside of town for him to go to, at which point the state investigated our facility as the family filed a complaint. Obviously, it wasn't the fault of the hospital. He received excellent care, but nobody should sit in an emergency room for 3 weeks when they're acutely ill and going to harm themselves. A second example is a 24-year-old female soldier I'm currently caring for who had a .50 caliber shell explode in her hand. She lost her hand. I've spent less time managing her wounds than I have managing her psychiatric wounds because I can't find an outpatient service for her right now. The effects on the community don't stop just with the patients who are seeking inpatient care. When a physician doesn't have a full complement of services to provide their patients, they don't want to practice in that area. As a trauma surgeon, if I don't have an operating room, I'm not going to work in the community. I can't do my job. The result is outpatient services are lacking, and if anyone has tried to access care for their child or for themselves, we don't have enough mental health providers in this region because we don't have facilities to provide them with ultimate care. And not only that, when you can't get these patients to where they need to be, they're in the emergency room. In 2011, over 200 patients in North Carolina waited more than a week in an emergency room for placement, and in the number of days up to a week, the number is much greater. So when you take your child from the YMCA soccer field with a swollen knee and you wait in the emergency room for 6 hours, this is a contributing factor. So it does impact all of us. Why Davidson? Why not put it at another parcel? Well, Davidson, we live in a bubble. We're an educated community. We're a compassionate, intelligent community, and those very issues, which often protect a lot of us from needing these services, are the exact reason we can look at these facts objectively, avoid the emotional misconceptions, avoid the political risk that led Huntersville, I think, to make an embarrassing decision to not host this facility. These are patients who need care. They're patients who live among us. They're your family members. They're your friends. I think we should be proud to host this facility. In addition, I agree with the debate regarding process. I think we should examine the process closely. I think questions have been raised which are very legitimate and deserve a look. I do not feel, however, that this facility has suddenly sparked that debate. Those issues have existed. Those issues will continue to exist in the next project. I do believe it's become a convenient issue in a way to avoid supporting a mental health facility. One of the presenters of due process commented on how important it was to build the tax base. We all agree with that. We all applauded when the new offices were going to be built near the exit. One of those individuals in a one-on-one conversation commented to me he hoped it would be a school. School's not going to improve the tax base. He hoped it would be a park. The park won't improve the tax base. We need to have that debate, but this needs not be a political football. It's too important for the health of the community. When we develop projects around this community, both in town and out of town, their effects we need to debate. We need to make sure that this projects fit the scope of Davidson, fit the mood of Davidson, and I think this one fits quite well. Thank you.
Hi. This is the first time I've ever spoken publicly about my family's personal battle with having someone in our family suffer from mental illness, so I hope y'all will give me some grace. This year, I became acutely aware of how desperate the need for more inpatient mental health beds was in Mecklenburg County when my sister faced a crisis and there was nowhere for her to go. She's a 34-year-old nurse, and for the past 15 years, she's been battling bipolar disease, type 2, which means that she spends a good deal of her time battling depression. She does her best to keep going every day. She's a wonderful, talented, compassionate nurse. But this January, when a physical illness piled on top of her emotional struggle, she was unable to keep fighting, and she made the decision to try to end her struggle and wound up in the ICU for a couple days. And when the time came for her to leave the intensive care unit and leave the hospital, the psychiatrist that came to talk to us said, your sister needs to be in an inpatient facility, which we knew. However, we have nowhere to place her. There's nowhere for her to go. Now, I don't know if you can imagine how it feels to have someone that you love so dearly, so desperately need help and so desperately want help, and you not be able to find it for them, for someone to tell you, I'm sorry, we can't do anything. Meanwhile, she's hanging on to life by a thread. And that's where we were at. So what we did was, frantically Facebook, email, Google, everything we could possibly find, and wound up getting her admitted to a facility about 45 minutes from here. I'd like to tell you that took care of it and she was back to work, but that's not the case. And once again, we found ourselves in crisis not long after she was back home. We, again, were in the same situation of what do we do while she's, showing me this pile of pills that she had, was hanging on to. We were frantically searching for another place to send her. And unfortunately, it wasn't going to be anywhere nearby. So we wound up taking her to Pinehurst, which is 2 hours from here. Unfortunately, my parents live near there, and she spent some time there. Unfortunately, that's not the end of the story, and we were back in the situation again, and the next time she was able to be admitted to CMC's facility downtown, and I'm praying that before long she'll be back to work and back to life again. But I know that, having been through 15 years of this struggle, I know that the time may come again where we're frantically looking for somewhere for her to go. And that's why I'm so grateful that Davidson has embraced this project. I am probably one of the few Republicans in Davidson, and so I understand the concerns about the tax base and the due process and all of that, but I can't say that I'd rather see a restaurant and bar in that spot if I'm concerned about safety or those sorts of concerns there, and I'm grateful that our town is providing this for our community, and that's one of the things that makes Davidson a great place to live. Thank you.
Good evening. As the introduction, I said I'm the Executive Director of the Mental Health Association of Central Carolinas, and I'd like for you to know that that's a local nonprofit that's been serving Mecklenburg County since 1933. Our mission is to promote mental wellness within the community, and we do that through advocacy, prevention, and education. We do not provide any direct services. Because of our work in the community, we interface with many contracted providers, private practitioners, hospital representatives, consumers, and families. So we get to hear a lot about what's happening in the community. Many who call us for information and referral are usually experiencing some type of mental health crisis, either personally or within their immediate families. From conversations with all of these individuals, I can tell you and reiterate that there is a need for another hospital for additional beds in this community. CMC Randolph currently maintains 66 psychiatric beds in Charlotte. It operates at 111% capacity, so this is why we've got people waiting weeks. They see more than 16,000 patients each year. most of those critically ill, and most of those not getting into a bed because of the lack of availability. Since the 1990s, our county has doubled in population, and at the same time, we've lost nearly half of our psychiatric beds. With the current economic recession as one factor in our local system, we're experiencing an increased demand for services. However, again, with the shortage of beds, we're having to turn too many people away. I'm told opposition to the new hospital may stem from concerns related to politics and finances, which we've touched on tonight, and on community safety, which we touched on briefly. And while I can't talk to the finances and the politics, I can tell you a little bit about misconceptions related to the correlation between mental illness and violence. As a group, individuals with mental illness are no more violent than any other group in our society. In other words, rates of violent crime perpetrated by individuals with mental illness are found to be no different from the general population. Mental illness alone does not incline a person to violence. Among factors contributing to violent behavior by individuals with or without mental illness is untreated substance abuse. That's a key factor. The majority of crimes are not committed by people with psychiatric illness, and studies have demonstrated there is very little relationship between mental illness and violence. In fact, studies show individuals with mental illness are more likely to be the victim of crime rather than the perpetrator. Untreated mental illness is more likely to result in self-harm, self-inflicted injury, or suicide rather than in harm to others. And again, the key here is treatment, and we desperately need treatment services in Mecklenburg County. All politics aside, on behalf of our most valuable citizens, our community needs to be better prepared to meet the demand for mental health crisis services. A new hospital is needed, and we all need to figure this out and work together to ensure that this happens and that the hospital operates successfully and that ultimately it benefits the entire community. Thank you.
That concludes all the presentations, and now we're at the point in the agenda where any of the panelists can certainly offer a response. Does anybody wish to do that?
I'd like to say, first of all, thank you to everyone for their participation, their comments, and their insights. I think one of the key purposes of us holding this community forum was to create a dialogue and to provide an opportunity for education and information. And I think that has been a success of what we've started here, and look forward to some feedback and questions from the people in the audience with questions and answers.
Anybody else? Other questions available in the basket? Yeah, absolutely. For anybody who has not had an opportunity to place a question in the basket, why don't you raise your hand, or if you need a card, raise your hand, and somebody will take care of that for you. Okay, the first comment and question: outpatient care for vets can be accomplished same day at Salisbury VA. Why do you not know this? And it says here, Dr. Bately to answer.
Outpatient care for vets can be accomplished at the Salisbury VA, but actually contacting the VA, getting approval for the outpatient services, filling out the paperwork, and then discussing the matter with a provider at the VA is not a same-day service. So while in theory and on paper and in policy that's true, in practice it is certainly not true. I care for a lot of vets, and the vast majority of the vets I care for prefer not to be treated in the VA system because the care they get there has been inconsistent and not up to the standard of the community.
Okay, next. The issue of concern is how this project was brought to Davidson To what extent were the town commissioners involved?
After the Huntersville, rejected the project in Huntersville, Mayor Woods, I think, had conversations with commissioners and wondered if there were any interest in suggesting to CHS that they look at potential properties in Davidson. There was general agreement that we should do that and see if it would work. We all knew at the time that it would not be a tax revenue producing unit. But we met with Mary Beth and showed her about 4 sites, I think, and the one that clicked happened to be the one that we're talking about today. I have since learned that Community One Bank, at least, tells me they were already having conversations with CHS about the site before we met with them. So that was our involvement.
Okay, next question. What was the process to send formal zoning notification to neighbors? We live very close and did not have an opportunity to appeal to the appeal.
We followed our attorney's advice, and he followed the statutes, which I believe is that we sent the letters to the adjacent property owners. We were not required to provide it to anyone else.
If the hospital is built as planned, what will be done to ensure the patient's confidentiality? I'm just going to read this. In a gossiping town like Davidson.
That's the nature of small towns, you know.
Well, not quite sure how to answer that question. Certainly from an inpatient standpoint, all admissions are planned admissions, and that means that all patients who are admitted into the inpatient facility are going to be having their admission process coordinated by a bed management system at CMC Randolph and transported securely from wherever they're coming from, which is typically going to be an emergency room, to the facility, entering in through a sally port, and then onto the unit. So from a standpoint of seeing somebody being transported into the hospital and then breaching a confidentiality issue there, that is very, very unlikely. From a standpoint of the outpatient clinic, it operates just as an outpatient medical clinic, so whatever confidentiality issues or concerns that any individual might have about going to a physician's office in the medical community would, I guess, be relevant here. But in addition to that, the land requires, and I think future road structure developments require that the facility be pushed back further on the land, so there's an entryway into the actual building and site. So from looking at it from the road, I think that also enhances confidentiality.
Okay. These two questions are very similar. Why didn't the town reach out to other area towns to form a partnership for a regional resource?
The only other town I think that was an option was Cornelius. Huntersville had already rejected it, and I believe the facility had to be in Mecklenburg County, so that eliminates Mooresville. And Cornelius was pitching their own site. So there was never a discussion. I don't think there was even time, as far as I know, to have that kind of discussion.
Since this was such a contested issue in Huntersville, why didn't the town choose to give conditional approval and provide an opportunity for economic review?
As discussed earlier, we approved zoning in September of 2011 that allowed a design of this nature to be approved by planning staff. So there was no option to do that. We already had done a 9-month process that put in place the process we have, and we were following.
Why were very few people given formal notification of the project thereby protecting or giving them their right to exercise their rights to an appeal to the Board of Adjustment. Sorry, I couldn't read that all.
I think I answered that earlier in that we notified the folks that were required to be notified by statute.
What barriers are in place that could prevent the project from moving forward? That's one question. How many clinicians are planned to be hired? And then when will the hospital be opened if all goes according to plan?
I'm not going to answer that first part.
As far as the number of the staffing, we're looking at having about 5 psychiatrists. We're looking at almost 11 psychiatric social workers. We're looking at 41 nursing staff. We're looking at 38 psychiatric technicians. This is for the inpatient hospital. For the outpatient area, we're looking at an additional 2.5 FTEs of psychiatrists. We're looking at 1 psychologist. And we're looking at about 2.5 psychiatric social workers at this particular time.
We don't. You might have half-time people, just to clarify. By way of the schedule, as I indicated, we're looking at construction start in the fourth quarter of 2012 with a facility opening in the fourth quarter of 2013.
Are there restrictions on expansion in size and scope of treatment?
I'm not sure if that question is directed towards the town, like a town question about restrictions, or at CHS. From a hospital perspective, we are building the 66-bed facility through what's called the Certificate of Need process at the state level, which means that all hospitals have to utilize the CON process so that the state can certify that the project that is being requested is necessary for that community and not going to over-provide services that are then unnecessary. So the state approved our request for 66 beds. If we needed to expand the inpatient site at that location and add additional beds, the site allows for that to happen, but we would need to go through that same Certificate of Need process, and the state would need to assess at that time if the types of services that we would be suggesting we would offer would be necessary, and if so, they would approve it at that point.
Okay, and this is specifically directed to CHS. What were the nature of the police visits to the Randolph location? What were the typical issues?
At the Randolph facility, visits from the police are really categorized into one broad category, which is patient transport. And as you may understand, patients need to have an involuntary commitment, which requires delivering papers. So there is a whole phase of work that is involving the police in bringing those papers to the facility and serving those to the patients. So that is probably over half of the services that we have. The second part that we have looked at is on the inpatient side, what are events that have happened where the police have come to the facility. So that would be very similar to this. And we've had incidents where there was a theft of a cell phone in the car. We've had incidents where there were interactions between 2 patients that required the police to come because one of the patients chose to press charges. We have had incidents where on the inpatient side there are activities that there is another kind of device stolen or a police report generated. So, and for patient confidentiality reasons, it's kind of categorized in those broad categories. And we had 17 of those in 2011.
Okay. A question and then a comment. Hard to tell from the map exactly where the entrance road is to the proposed facility. Could you be more specific where it is. And then a comment, Summers Walk, I guess, was not informed of this proposal. I'll hold it. There's something on the back. Was not informed of this proposed project. In fact, my daughter, who lives in Southwest, was not aware of it. I called her of the news from davidsonnews.net. The angst, something for Saucy Burbank, was not even aware of this proposed new facility so close to Summers Walk. So the question is, where exactly is the entrance road into the proposed facility?
And right now, if you take an opportunity to look at the site plans that are on the boards, you get an indication of where that road is. It will be somewhere along the frontage. Right now, we are working from a civil engineering perspective, looking at the site. There's some questions about wetlands and other things that road may slide along the frontage. But if you look at the site, you can see where it is in proximity. But we would bring that road along the property line, either on the side that it's at. It might slide a little bit as we work through some of those approval steps.
Okay. Why was there no formal economic data prepared by the town before launching into this project?
We were not sure that CHS would even find a site that would be suitable, first of all. And it had happened fairly quickly, in my opinion. And we have been working since then to try to do the physical impact analysis. It was, as I said, difficult to find comparables. It was difficult to get the call data from Medic. It was difficult to get the call data from Charlotte Fire. And also getting someone to do the physical impact analysis. They have other work to do, and they can't do it at the drop of a hat. So we actually got a draft of the report a couple of weeks ago. The final was today. We had some last-minute information that came in Tuesday, and so I got it today at 3:15.
Okay, this is for Dr. Gettleman. Please distinguish between a detox site and admission of patients with dual diagnosis.
Detox site is for an individual who has an acute need for typically medical detoxification from substances like alcohol or other kinds of drugs, where they are in a medical state where they need medical oversight and medical treatment to detoxify their body from the substances that they have been abusing. That is something that is offered in CHS at one of our other facilities. A social detox program, if you will, which is not as medically overseen, is offered through Mecklenburg County, actually in the same parking area as where CMC Randolph is located. It's not something that we would be offering at this particular site. And dual diagnosis patients that would be treated at the site, they would be admitted not for their substance abuse issues. They would be admitted because of the psychiatric conditions that led to them needing that type of care. We would be treating their psychiatric illness to the point that they're ready for discharge, and then we would be recommending and referring them, if they needed substance abuse specific treatment, to a local substance abuse provider post-discharge.
Okay. Assuming you receive the process that you are seeing or believe you are due, are there any, and this is for Due Process Davidson, are there any circumstances under which you would agree to the development of this facility at this location? If so, what are they?
Well, I think the answer to that is we want due process. We would participate and honor the process if it was allowed to be handled properly in the 30-day period reopened. We've heard several questions from people that are nearby, never received a notification. I think to only send a notification to adjacent property owners, assuming they're the only people that could be potentially aggrieved, is irresponsible. Okay, the town showed their map where they had lines drawn to multiple residents that they then gave us real estate impact reports. So how can you say on one side it's only people that are adjacent to it that could be aggrieved, and on the other side draw a line on a map to more than that? It just doesn't fit. So to answer the question, if it's properly done and properly discussed and it is handled in a transparent manner rather than a clandestine manner, I think we would support the eventual decision.
Okay, and similar, not being very familiar with due process, Davidson, when did this group form? If not a NIMBY issue, why not pursue the issue of process of planning, etc., with the town as a separate issue for formalizing process, transparency in general, and not legally pursuing a stop to this project? That's part one. Part two...
my memory's not too good. Can we answer part one?
Yeah, you can answer part one first.
You want me to do it? I'll get that one. We have resisted legal action to this point, and the reason we've resisted legal action is because we've had countless meetings with Mary Beth and the CHS team, other meetings with the town planning group, but unfortunately there's been such little data available because the economic impact analysis wasn't done on the front end that the nature of the discussion hasn't been very productive. So I think in good faith to try and allow them to catch up, we've resisted legal action. But, as you saw tonight, the gap between what we know is real in the economic impact and what they're promoting is so significant that we might not be left with another choice. There's another part of the question.
And part two. John McQuarrie is a property owner who did not receive a letter according to your slide. Is your concern about the process? If properly planned, would you approve the facility?
That's me. Yeah, I'd approve it, and it's more about planning and economic impact for many of us who have, again, Chris and I are representative of several families, more than you saw on the list there. And for me, it's about the due process of the decision. I shared with you I have a sister that's been mentally ill. She's 40 since she was 14. Our family's gone for treatment in Davidson, psychological treatment, not to this effort, but in my life I've done a number of visits to different places. So I'd welcome the facility. Mary Beth and the team know that. It's consistent with what I've said this entire time. It's very difficult for me and others on our group to accept the facility when you see the zoning process as loosely administered as this was and continues to be, and with the economic impact being it's nothing but negative. If you believe the data as factually as we have it today, it can't be a positive impact on Davidson. It has to be negative, and that's something the MI decision and this decision. How many more decisions will we allow before we begin to take the town financial decisions seriously? And, you saw it, 41% higher cost of living in Davidson than Cornelius. And I and others in the group just can't stand for that any longer. So will we accept the facility? Absolutely. If we can hold the town responsible to evaluate the process through which it's being slid in the zoning understanding. And then secondly, there are many options for which we could share the cost burden with others, multiple counties, multiple towns.
Okay. That concludes the questions. Are there any concluding remarks from any of the panelists at all? If not, thank you very much for your time and your attention.